Welcome to the Bachelor Clinic. I'm Dr. Dan Batchelor, and today I would like to discuss pronation and supination. So what is pronation? Well, pronation is normal. When you walk or run, the first part of the phase is where your foot impacts the ground a little bit on the outside of your foot. Then when you roll in a little bit, your foot collapses in a little bit and your foot pronates, so that when you push off with your forefoot, all the force should be exerted in the center of your forefoot. That's normal pronation. It's a good way to allow shock absorption to occur. The arch functions like a suspension bridge. It flexes a little bit and absorbs shock. So it's pronation that's normal, but excess of pronation or overpronation is not. So what happens is you hit on the outside of your foot and your foot rolls a little in too much, so that all the force is exerted on the inside of your foot. So what that occurs is your kneecap slides a little bit off center. So the kneecap slides a little bit off center like that when you pronate, and it can cause knee pain, because any gear, whether it's a human body or a machine, any gear or joint that doesn't mesh properly experiences increased wear and tear. The same thing occurs with the knee. You want to prevent wear and tear. If chondromalacia or runner's knee occurs, we can treat that, but it's always better to prevent. So what happens with the overpronator over time is it can degenerate the knee, the meniscus can wear excessively, and you can end up not being able to run any longer because you have severe knee conditions. So what do? Well, here's one way to correct it. If your motion control shoe does not correct it, then you have to wear what's called a Varus Wedge, which is an orthotic device that we designed at the clinic. Notice this is thicker and that's thinner, and this is a 4-degree Varus Wedge. So what it allows, it prevents the foot from rolling in excessively. So we analyze the patient biomechanically, chiropractically, orthopedically, and determine what type of imbalance exists and what we have to do to correct it. And with this person's condition, they required a 4-degree Varus Wedge to return their joint to normal position, so that the kneecap would slide in the center and not wear away off like that. So what's the supinator? This was an excess of supinator. Notice it says stabilizer, but it didn't stabilize it. So the person supinated, so all the pressure was on the outside of their foot. They hit out here, and when they rolled off, all the force was still on the outside of the foot. So the shoe warped according to the imbalance of the foot. That's what happened here. So they have to wear an opposite type of orthotic. The wedge has to be thicker on the outside and thinner on the inside, called a valgus wedge. This is a Varus wedge. This person needed to wear a valgus wedge so that everything was mechanically in alignment. So those are some of the things that we do here at the Bachelor Clinic. I would love to be your doctor of chiropractic. If you would also love to be a patient here, call us anytime.